At this point, I have no desire to get the vaccine.
I did not want to put anything foreign that, so new in my body.
I would ask them, have you been vaccinated? Are you interested in being vaccinated? If they say no, I ask them why.
We're trying to stop the reproduction of our race. That's one I've been hearing.
Every adult over the age of 18 or older will be eligible to be vaccinated.
Where does this resistance really leave us? Are we in real trouble here in terms of achieving the kind of blanket of protective immunity that the country needs if we're really going to be able to go back to normal?
For a long time, the early part of the pandemic, I was getting intelligence from the barbershop. These are places where conspiracy theories can grow, or where we can bring evidence-based, scientifically accurate information to the community.
A lot of my clients trust me more than they even trust their own physicians.
Sometimes I'm a marriage counselor, sometimes a fashion consultant.
Mike sends me a message and says, here's one of these flyers being circulated in the barbershop. It said, COVID is a hoax, don't take the test, don't take the vaccine. Vaccine wasn't even developed yet.
You can take it, Mike, but don't give it to your kids. They're trying to stop your kids from reproducing. I've heard they're trying to put the chip in.
But we have this conversation every time my clients sit in my chair. So when they sit in my chair, after I do their consultation on hair, the next question I would ask them, have you been vaccinated? Are you interested in being vaccinated? If they say no, I ask them why. And what I realized, a lot of my clients couldn't answer that question. So what I did was I started doing research to be able to share more information with them.
The divide between hesitant and welcoming seems to map pretty closely to political party, which again reflects how everything in the U.S. has gotten polarized along political lines, although it doesn't make a lot of sense scientifically.
When the vaccine first came out, I had decided that I was not going to get the vaccine. I have never gotten any kind of vaccine for the flu or anything like that, and it just is one of those things that I just did not feel comfortable doing. My husband and I talked about it. He was on the fence as well, but he came around and he had been talking to me about getting the vaccine as well. We signed up to get the Johnson & Johnson's yesterday. We were supposed to get it, and of course they paused it. So I was like, is that a sign? Should I just back away from it?
I'd like to see a little bit more time pass with better results on the vaccine before I jump on. We've had a lot of recalls in certain vaccines. Some have been pulled off, some have had to be thrown away, and so there's a lot of unanswered questions. I'm of the philosophy of believing that when it's my time to go, it's my time to go. Some of these chemicals that are put in our body that we don't know how they're going to react to us is a little bit of a problem.
I think in general, Republicans may be skeptical of what academics and that includes scientists in academia are all about, may be seen as sort of an elitist group and not some group that you could be confident has really got your best interests. Probably the most important thing we can do as far as addressing hesitancy is to listen.
Unfortunately, we still have clients out there that are still skeptical about taking it, and the approach that I've taken from my platform is to try to convince them otherwise, and just to try to not go toe-to-toe with them, but explain to them, the truths.
People think you're shaming them. People think you're looking down on them. But by watching Mike, he just listens. So it's a conversation. It's not like I'm coming in to message you, pitch you. I think that's a lesson for us in the health professions.
Compared to the hypothetical risk of a vaccine, which is now in the United States been injected into more than 100 million people, and it's been going really well. So if you're sort of waiting to see, is this working? I think the answer is yes, it really is. Compare that risk to the possibility of actually getting this disease and ending up in the hospital or the ICU or even dying. It seems like a pretty good balance.